I'm Dr. Robert Johnson here with Summit Orthopaedics. I specialize in spine, and more particularly, I specialize in robotics and artificial disc replacements of both the cervical and lumbar spine. Patients ask me a lot of times, why did I go into spine surgery? And I think a lot of it stems from my own personal life and my family life. My mother was involved in an accident as I was a child, and back then they did not necessarily have the same technology and the same advancements that we have nowadays. And so the type of surgery that she was relegated to, specifically the type of fusion she was relegated to, helped get her over that accident, that incident. But unfortunately, that type of surgery has repercussions, both short-term and long-term. And I watched throughout my childhood and my whole life her having to deal with the repercussions of that accident, but then also the surgery itself. And that's what's really driven my practice in trying to help patients get back to a normal, active lifestyle, maintain that active portion of their life to be able to return to the things that they love. A lot of times patients kind of ask more about our artificial disc replacement, how long they've been around, and to tell you the truth, there's a lot of misconceptions out there. Disc replacements, for example, have been around since 2004, and then subsequent editions have been released 2006 and 2015. And so there's nothing investigational about them. They've actually been around for over a decade and even longer in European studies and markets. And the difference between typically a disc replacement and a fusion, which is a traditional surgery done for various types of spinal conditions, is a disc replacement preserves active and passive range of motion. It allows the patient to maintain a more active lifestyle without necessarily the same repercussions. And when applied in the appropriate patient, and in an appropriate setting and conditions, that patient can have equal to or even better outcomes than traditional spinal fusions. One thing I've really geared my practice towards is disc replacements, both cervical and lumbar spine, but then also robotic spine surgery, which allows us as surgeons to be more precise, more accurate in our actual surgical applications, and therefore reducing risks and potential complications to the patients, and ultimately providing a better outcome in the long run to those patients. So here at Summit Orthopaedics, by implementing some of those most advanced technology within the spine realm, through robotic spine surgery and through artificial disc replacement, we're able to help patients recover faster and return to a more active, normal lifestyle than ever before, and even more so than even traditional surgical techniques. If you've ever been told you need spine surgery or you need an intervention, and you've had questions as to whether or not what you're being explained or what your options are, feel free to reach out and give us a call. Come in and visit with us. Let us help guide you and show you what some of those options are and whether they're appropriate for you and for your specific case.